One of our key principles in our agenda, IWA agenda, is the first letter, which is the H, which stands for health. In our mission to accomplish that agenda, in the health sector, we have deemed it fit, to augment and supplement our medical intervention with this kind of collaboration with Eko Atlanta. Eko Atlanta has brought in professionals, medical professionals from all aspects of medical fields, to Odi-Olowo. They arrived on Friday, and we've received them here immediately from the airport. So we feel that this kind of, we all know what medical tourism entails, just because of going overseas, traveling abroad, to get the best of medical health check. So what we have done is to bring this back locally to Ojuwoye, where we have assembled all our residents, cut across the gender, the aged, and of course people with fear that are living with disabilities, for all of them to come together and benefit from this medical tourism. We believe that this kind of intervention, will further, help our constituents, to first identify, what kind of medical, their medical status, which itself, we all know that when it comes to health, the prevention is always better than cure. So that aspect will be well taken care of with the complete medical examination that is taking place. And of course, they've come with a lot of medications, to support everybody that might have one medical disorder or issue. My advice to the residents of Odi-Olowo, is that which we continue to sensitize our people, that medical health, for us is something that they need to, pay attention to, identify what is wrong, have a complete medical checkup. And that is what has informed us as government, to completely eliminate, the cost of all medical examinations in all our PACs. We have started we have initiated a program where all of our PACs will offer completely free medical services to everybody within Ojuwoye LCDA. Because our belief is that for every resident that patronizes our PHC, our initial step is for them to have to pay a token amount, to obtain a card, which we believe that is the first step in having an health check. So what our government has done is to completely eliminate that cost, the cost of getting card, the cost of getting attention from our medical doctors have today been eliminated in Ojuwoye LCDA. So all our medical services are completely free. Across all our IWA agenda, we have simultaneously, worked across all of those letters, and all of those branches of IWA agenda, starting with health, which is part of what we are doing here. We are constructing a primary health care center in Kayode, which we started with this administration. In terms of health, we have further, ensure that everybody within the downtrodden, especially people, that have, they are people with less funds and considering the economy, we have further eliminate any cost, that you can get all our medical services within Ojuwoye at zero cost, And so as far as our health concerns, health interventions are concerned, we are extremely intentional about delivering health services to the people within Ojuwoye at no cost. This is a flag off for our medical tourism. From this, we are going to the wards. We are taking our medical tourism to each of the wards. So taking the health facilities to every person within the community. Across education, in the first of its kind, back to school program in Ojuwoye. Our back to school program was tagged back to school and back to pocket. It's a 2-in-1 agenda where we have ensured that our back to school program commenced earlier than the date of resumption, which will save the parents of these kids or guardians from going to purchase all of the educational materials before school resumption. So the traditional method of giving to students on day of resumption was eliminated, and we resumed, we adopted a new innovation, including starting off this educational intervention weeks before resumption. And what we have provided are all school essentials, from school, the school bag, all writing materials, And in our education, we have also provided what we call the Odi-Olowo, which we commissioned some weeks ago. This is to ensure that, we have good nutrients, we have good feeding process for all our students within Ojuwoye, and all of these are, of course, completely free.